If you're getting plastic surgery, you will have scars. That's the truth. But here's what most people don't realize. Scars don't have to define your results. And with the right surgeon, often they don't. In this video, we're breaking down what to expect from plastic surgery scars, from how they form and heal, to the techniques and aftercare that help make them as minimal and discreet as possible. Hi, I'm Dr. Ramon Garza. I'm a board-certified plastic surgeon who specializes in complex breast reconstruction and aesthetic surgery of the breast and body. I make educational videos to help you make informed decisions about plastic surgery. Every surgery that cuts through skin leaves a scar. There's no such thing as a scarless plastic surgery, no matter what you've seen online. But a good result isn't about avoiding scars. It's about making them nearly invisible and shaping the body so beautifully that the scar fades into the background. And that all flows from our core surgical philosophy, function over form and form over scars. Here's what that means. If I do a perfect rhinoplasty, but you can't breathe afterward, that's a failure. If we trade a slightly longer scar for a dramatically better result, we'll make that trade every time. So how do we achieve that optimal outcome? When it comes to scarring, it all comes down to placement and technique. For example, in a tummy tuck, we position the scar low, below the underwear or bikini line. In breast surgery, scars are typically hidden in the natural folds beneath the breast. With liposuction, the incisions are just a few millimeters long and placed in discrete locations. Our goal is to minimize visibility without sacrificing function or safety. That extends to how we close the incision. We don't use staples for procedures like tummy tucks or breast lifts. They leave visible tracks in the skin. Instead, we use internal dissolvable sutures that create a tension-free closure. This reduces stress on the skin and helps the scar heal flat and smooth. For breast and body surgery, this is the gold standard. Your post-op care plays a huge role in how your scar matures. I use a tension-reducing surgical tape over the incisions for the first 3 weeks. After that, I recommend medical-grade silicone scar tape, applied consistently for at least 3 months, but longer is better. This helps regulate collagen formation and reduces the risk of a raised or thickened scar. Another thing to keep in mind, your genetics play a role too. In general, older patients tend to scar more softly because their inflammation response is lower. Fair-skinned individuals tend to form lighter, finer scars. Darker skin tones may be more prone to pigment changes or hypertrophic scars. But the most important factor is your personal history. If you've had a history of keloids or poor scarring, tell your surgeon. That can absolutely influence your treatment plan. For example, if someone has had borderline cases for a breast lift and is known for having keloids, we may avoid the lift or take extra steps to reduce that risk. Now, if you've already had your surgery and you're around the 3-month mark, you may be noticing that your scars look red and raised or irritated. That's completely normal. This stage is when scars often look their worst. Your body is still in its active healing mode, laying down collagen rapidly, but in a disorganized way. That's why the scar might feel bumpy or look inflamed right now. The good news, it's temporary. Over the next several months, usually between 6 months to a year, your body reorganizes that collagen. The scar softens, flattens, and fades. So don't panic. What you're seeing right now is part of the normal healing process. Stay consistent with your scar care and give your body the time it needs. There's one last point I want to make, and it's critical. Not every doctor performing cosmetic procedures is a trained plastic surgeon. Some call themselves cosmetic surgeons, but may not have completed any formal plastic surgery training. Some aren't even surgeons by specialty. When choosing your doctor, ask directly, are you a board-certified plastic surgeon? That certification means they've completed at least 6 years of rigorous surgical training and passed the examinations required by the American Board of Plastic Surgery. If the answer is anything else, walk away, it's not worth it. Also, look for this symbol. It's a sign that somebody is board-certified in plastic surgery. Look, scars are a reality of surgery, but they don't have to steal the spotlight. With the right surgeon, the right closure technique, and the right aftercare, we can help them fade into the background while your results take center stage. If you're considering surgery and scars are a concern, bring that up in your consultation. We'll walk you through exactly how we plan to minimize them from day one. If you enjoyed this video or have any questions, please like and leave a comment. We appreciate all your support. If you want to see more before and after results, check out our Instagram page or our website. And call our office to set up a consultation. We'll see you in the next video.